Hi, this video is of a more serious topic, and it's suicide prevention because the month of September is Suicide Prevention Month. So the sign for suicide. I mean, most people do not spell it, but it's yourself kill. So when I've been interpreting in a counseling situation, have you thoughts about killing yourself or yourself kill? Or there have been some people where you slash your wrist, but that's not always how people, um, um, that's not all the suicide methods, right, or attempts. So the month of September is also suicide prevention. Prevention yourself. Usually you use a person yourself. You can do this one, but mostly it's yourself kill. Prevention, you want to have that barrier up, prevention. And so let's do some, helps for if you know someone or yourself. So they say to call 988. And that is a suicide prevention line. Also, there is a website, and it's 988 lifeline or lifeline.org. So it'd be 988lifeline.org. They say there's some risk factors. There's some warning signs. So the warning signs for suicide would be if someone is increasing their alcohol use or their drug use. Now, this is usually an intravenous. You can do drugs, but this could also be like for prescription medication. So drug use, drug use. I would use both signs because it means different things for different people. This is if you really do, you use, heroin or something like that. They use through a syringe. Or an IV. So that's what that is, where you're injecting that. Drugs, this could also mean prescription medications or something that you inhale or those kinds of things. So I would not go to the whole list unless you feel like you need to. So like cocaine, marijuana, this is more the hardcore. This is any kind of, or you can do illegal drugs. Because some people say, well, it's a prescription. Well, if you use it too much or it's an overdose, you could do that. So, drug use or drug use. Okay. If they have an aggressive or aggressive behavior, this is to fight, right? And this is aggressive where you could just be, really always on guard. I had a boss that did this. This is the sign for like gang. And so she said that her sister was aggressive, and so she always used this one because she's always ready for a fight. Or, it can be, it also can be a verbal argument. They could withdraw. So here you are, when we're involved, now you've withdrawn. And that means you can withdraw from school. So like in college and you have a withdrawal slip, you're withdrawing from that class, you can withdraw. But this is also withdraw from family and friends. You kind of separate yourself. You're not involved in activities with family. You're not contacting them, those types of things. And it's like your dramatic mood swings. So the mood is like M and it curves, or you can even do MD because it's like personality, character, mood, up and down, swings, right? So a mood swing is a mood, and then I would almost do it like a wave, or a roller coaster, that type of thing, mood swings. And when they say impulsive or reckless behavior, you could just say, this is impulsive is a little bit different, but reckless, you could do dangerous behavior or do an immediate behavior or without thinking. She just does something suddenly, something like that. They could also, there's some other signs for if someone is thinking about suicide is they are collecting, or they're saving pills, like they're collecting, they're just kind of saving them, they're not taking them because maybe they want to OD. They are they buy a weapon if they use that, and all the things that they own, they're just kind of giving them away for, oh, here, have it, or whatever, and so they don't have any possessions. Trying to organize all their papers, making sure everything is taken care of, so there's no like loose ends. Telling people, oh, it was good to see you, and I don't know when I'll see you again, or whatever, and telling them goodbye. And I'll go into more about that in just a minute. Risk factors, if there's a family history of suicide, if people are addicted to drugs or abusing them. They said that 1 in 5 people who die from suicide had alcohol in their system, so not all. They have an access, to a weapon. They have serious mental illness. They say that more women try suicide, but more men actually die from suicide. History of maybe abuse. They have stress for a long time, and they've had a recent tragedy or a loss. So those are the risk factors. But sometimes, and most of the time, more men die from suicide. More the people, they say, if they say I'm gonna kill myself or whatever, then pay attention to that. But most of the time, I've noticed that if they say that, they're trying to tell you, I'm stressed, or I have all these problems that I can't solve, or I'm just really having a hard time. So, and they want help. That's their way of asking for help, but they don't know the solution. But also notice that more people who actually die from suicide say nothing. So you have to be careful with that. Also, they talk about gender or different races that die from suicide, but also I noticed they didn't really say about veterans or ex-military. They die from suicide as well. There's a big number for that. I'm going to just tell you, I have a history of suicide in my family, and when I do family research, there's more and more family members that I'm noticing that die from suicide. So it is a history in my family. And I've noticed that the people that have died from suicide, they've all been men, and they have said nothing. It was always a surprise to the family. But when you look back, they notice some of the same things in common. I went to a group one time, and I noticed that all the people said the same thing, that the day they decided, they were in a better mood. They were doing things, they were preparing, I'm going to go on a trip, I'm going to go visit with some friends, I'm going to go camping. So the family wouldn't expect them to come back for like the weekend or a week, whatever. And so they didn't worry about that until like later, several days later, and then they find out that family member has died. So it's, sometimes you just don't know. You always look back and think, what could I have done? Could I have connected more? Could I have done something to prevent it? I don't know. People that actually die from suicide, they plan it so that no one is there. They don't want anyone to save them. Could you have done something? I don't know, because they had that prevention line, but the people that I noticed that are really die from suicide don't contact other people for help. They don't call the prevention line. But there's some people that don't know a solution. They're hurting so bad that they do call. They do say, well, I don't know what to do. I'm going to kill myself. Or they'll say something, or they'll call the suicide line. And it's a very busy phone number. So it is important that there are many people who reach out. There's many people that may attempt it but then decide not to, and they go and get help. They go to a hospital or a counseling center or the police or wherever. They go somewhere to get help. And those that do normally get help. But there's no guarantee. I mean, you want to try and do whatever you can. So they say the prevention to try to do is, let me get here, is to talk openly about it. You're not giving them ideas, really. You can ask, do you have a plan? If they say something, say, well, do you have a plan? If they don't, then it's called ideation. They're just thinking about it. They don't really have a plan. Well, I'm going to do this, and I will do it whenever or when this happens or whatever. Also, if they talk about it, you may want to remove any guns or knives or anything that could prevent that. If they are seeing a psychiatrist, you can ask, do you want me to call your psychiatrist and let them know what's going on? So if there's other people that are around and they're talking about them, have them talk one at a time. But it needs to be a real conversation. They said, don't argue, don't yell, don't discuss, oh, suicide is wrong, don't do that. They're not thinking that. If you are nervous, don't make those nervous, like, or walk around or whatever because you're nervous that they will do that, because it causes them more anxiety and more stress. And to be patient. All you can do is try to connect, try to help. Do you want to talk with someone? Those kinds of things. Maybe we can find a solution. What would help? Those things would be helpful. If it's an emergency, don't hesitate to call 911 because you want to help those people. But sometimes you just don't know. You just don't know because they withdraw, or they keep the withdrawal a secret, really. Say, oh, I'm busy, or I can't go, or they don't answer, or they'll text, I'm fine, or whatever. So you just never know. They may not show depression. They may not show the stress, and you don't know what's really bothering them on the inside that would cause them that. So just be aware. You want to tell them that yes, there is hope. I do hope and fingers crossed. I do both because some deaf people will use hope. They know what hope is, and sometimes they'll use hope. Oh, I hope so. Fingers crossed, right? So I normally do it almost as one sign. I do both, but you don't have to. You can have hope. You can have hope. There is hope. This is not really the time to preach. You just really want to listen to them. And I think it's more prevalent because there's so many stresses that people have that they don't see a way out, or they don't see a solution. And it may be hard to get a solution. I mean, it really is. And the point is they're thinking, I just escape, or um, I don't know, I don't know how, or I don't know what to do, or there's people rely on me and I can't, or whatever. They maybe have mental illness, and they may have, this drug or alcohol abuse, but not always, right? It's not always. You just never know. And when I see like a death certificate from doing family history, and I see that they, like the men, had a gun to their head, and they'll say that there was a bullet wound or in the chest or whatever, it's really sad because you don't know what was going on, and they were married, or was that a stressor there, or they lost their job. You just don't know. Or has it been a past drug use, or maybe they didn't even use drugs and they still did. You just don't know what people are going through, and it's not your fault. It's not your fault. You can try and do whatever you can, or if you notice some of these signs, if they're increasing any kind of alcohol use or drug use, or if they are all the things that they have and they're giving it away suddenly. And I think what the big red flag is suddenly a good mood. And we think, oh, finally they're coming out of that, good, and you have this relief. You don't realize that it's this red flag, like you should be concerned about it. You're thinking, oh, well, good. They're doing this because the good mood is whenever they decide what they will do. And then they plan it, and then they do it. And you just never know. So those are the big things that you just think, oh, okay, it's good, it's good. But if, like, famous like Robin Williams, or that cook, I can't remember his name, where we don't live with them, but we see them on TV, and they're always in a good mood, and things like, and you think, oh, it's good things, right? But obviously in their own life it was not good, and they were masking, masking, masking. Um, so it's hard to know because each person is different, and they may not use a gun. They may use a rope, or they may cut themselves, or they may, put a bag over their face and suffocate. So it's hard to know and what method, and you're not going to even notice, and people don't notice that. So I just wanted to, give all this information, but use it in sign language so you can use it in a conversation if you notice, or if somebody says like, I don't want to live, or I just want to die, or I just want to kill myself, or whatever. Then you can stop, halt everything and listen, going, what's going on, what's up, what's going on, or what's wrong. I don't know if you want to say what's wrong. It's going, hey, what's going on in your life? What, why do you feel that way? And really have that compassion instead of going, oh, no, that's wrong. Don't do that, because they don't care at that point, right? They may know it's wrong, but it's come to a point where they don't have a solution. So, so be careful with your ex-military family and friends, and your friends that have had a sudden loss. Um, watch them, and then if they have a sudden change in their mood, whether that's been before it was happy and now it's sad, or it was sad and now it's happy. So notice those things. Anyway, I hope you have a good day, and I don't want to bring anyone down, but it's an important topic. So I will see you later.